Okay, let's check out a little bit of self-assessment now. So what I would do if you came into my clinic and we found a little bit of weirdness down in your arm, a little bit of weaknesses, a little bit of maybe some sensation things, what I'm gonna be doing is I'm gonna be looking at your neck range of motion. What does that mean? So I'm looking at how well you can take your head forward and how well you can take your head backwards. So what I want you to do, if you are having any of these interesting symptoms, is I want you 5 times in a row just to take your head forward, only as far as is comfortable, okay? So don't take it to anywhere where it's like, oh, that's just pain. So just go to where you can come down, maybe that's a little weird, and then you come back up. Pay attention when you do that about 5 times if anything changes in your arm, okay? And then what I want you to do is we're gonna test it the opposite way. You're gonna be coming back 5 times. So I can tell you on myself, when I go back, all of my symptoms on the right that I typically experience start to get reproduced. I start to feel a little funky down towards the top of my shoulder blade. And if you look over here, I'll tell you where I get symptoms. So if you see there up at the top corner of my shoulder blade, I get a little kind of burning kind of sensation every now and then. When it gets really mad, it may travel down my shoulder blade area and even get to the back of my arm. If I do a couple simple testings of that and I really close it down even more, if I side bend and go back at the same time, I don't really care for it too much. So when you are doing your self-assessments, when you go back, tell me if it gets better or if it gets worse. So those are going to be a couple indicators. If you get worse going forward versus going backwards and vice versa, that will lead us into our next bit of the video series. Okay, so if you said, you know what, actually the more I went back, as long as I didn't do it to pain, my arm actually started feeling a little bit better. Who'da thunk? So what I want you to do, your treatment going right into this is you're gonna take a pillowcase, whatever kind of pillowcase you want. I like to twist it up a little bit just so I've got a smaller piece that's gonna go against my neck. It's going behind my neck, okay, so get the mane out of the way. You wanna go, start pretty low, and when you're pulling, it is only enough to give your neck a little bit of support. You're not really cranking yourself forward, so just enough to have a little bit of support, and you are just gonna be tipping your head over the pillowcase, giving a little bitty bit of pull. I'll show you from the side. So just a little bit of pull just to feel the tension, and I'm just tipping to where it's comfortable, and I'm coming back up. Never tip to pain, pressure only. Okay, so I am going to do about, I like to do about 10 to 15. So what I do is I usually do 5 pretty low. When it's really low, I keep my chin down. Tipping my whole head all the way back is just a lot to hold up, and it actually irritates mine. That feels good though. Okay, then I come up a little higher and I'm tipping, just tipping. Going right over the pillowcase. Then I come up a little higher. If it feels like you need a little boost to get your neck going back in that type of direction, you have options here. So you can be holding and you can actually go up at the same time to kind of help just promote that direction. If that's bothersome to your shoulder, that's fine. Just kind of hold here and just tip, okay? If on the contrary, when you were going forward, it actually felt like it was taking a little bit pressure off. Maybe it still felt like a stretch, like I don't love it, but my arm actually feels a little bit better. So that could fall into the category of a little bit more of a pinched nerve type deal. I try to steer clear of solid black and white, this is what's going on with you, because normally there's multiple things going on. But if you have a little bit more of a pinched nerve, we're gonna look at it a teeny bit differently. And instead of applying more pressure by tipping back, we're gonna give it a little bit more space. So if you can see over here, when I tip my head forward, some of that space in the back of the spine opens up. So some of your homework may be very specific directions. It might say, you know, if you're having pain on this right side, you may have homework of very gently doing 5 or 10 second holds, maybe up to 20 seconds or so, giving it some space here. May have you doing some just tipping forward. If that's uncomfortable, you can support your head on either your chin or on your forehead. Sometimes just holding up the weight of your head when things are irritated is not very comfortable. What you can also do is called a chin tuck. So when you do a chin tuck, it's like you're giving yourself a double chin, okay? So you're just coming this way, nobody's favorite angle, and then forward, okay? So from the side, you are just flattening and then coming back this way, okay? You could be getting a good stretch down here at the base of your head. You should feel a little fatigue in the front of your neck. Just a gentle stretch though, do nothing to pain, okay?